Physical Therapy Office Hours, episode 3. I'm Dr. Andy Baker, and I'm joined tonight by my colleague,
Dr. Miguel Vargas. Thank you.
Unfortunately,
Dr. John Fairman is on vacation enjoying his family time, so...
John, we miss you.
John,
hope you're having fun with the girls.
Absolutely.
Hurry back, we miss you. But tonight we're going to talk a little bit about low back pain and kind of what's the deal with low back pain. When is low back pain serious? When should I be concerned about my low back pain?
So that's a very good question. So low back pain, it's one of the things that we very often see in clinic. And low back pain, it's important to have a doctor of physical therapy take a look at you because it could be very serious. So for example, if you have any numbness in your saddle area, that means in your inner thigh area, kind of falls asleep on you. If you're having a lot of nerve type of numbness tingling down your legs that you just can't, no matter what you do, you can't shake.
Is that like where when you're sitting on a bike seat, kind of like your bicycle seat area?
Bicycle seat area, absolutely. Okay. Saddle area, that
makes sense.
Yeah. So those things, are things that your doctor of physical therapy can key in on and figure out if you're in the right place or if you need to go see another healthcare professional.
All right. So, sometimes we get really concerned about our back pain, and the reality is like 90% of us are going to have back pain at some point in our life, right?
Right, absolutely.
Yeah.
And that's another thing to kind of keep in mind is how long have you had this back pain? That can also play a role as far as, if you're in the right place or not. But I do get oftenly asked about, patients will come in and say, oh, Dr. Miguel, I haven't had an MRI or I haven't had an X-ray. So what do you tell those individuals, Dr. Baker, that want to push for that study?
Yeah, that's an excellent point. Oftentimes that's kind of that's a very big point of concern for somebody that's suffering back pain. They just think that, well, what are we going to do as doctors of physical therapy if we don't have all the information that an X-ray and an MRI provides? To be quite honest, X-rays show bone and bone only. They don't really show any soft tissue, so that doesn't give us a whole lot of information. MRIs are much more powerful and an advanced imaging technique, but even all that extra information from an MRI, when it comes to back pain, and if we've already screened out some of those other things like saddle anesthesia, numbness, tingling that will not relent, extremely bad pain in your leg, those ridiculous symptoms, or like a history of cancer and tumor, those kinds of things. If none of those things are present, and it's just a mechanical low back pain, the MRI probably doesn't really help us with a clinical diagnosis, and as your doctor of physical therapy, how we treat it conservatively through exercise, movements, manual therapy, certain modalities perhaps, but really I would say we want to focus on movement, strengthening, and manual therapy to help you get moving better. Because at our core, we're doctors of physical therapy, and we help you move better. We help you move more, and when you move better, you move more. Your back pain tends to resolve in a pretty regular period of maybe 4 to 6 weeks. Any acute onset of back pain. So.
Absolutely, and then to add to that, we also do a lot of patient education as far as lifting mechanics, proper ways of lifting, because many people, they just say, oh, well, I'm a strong person, I can lift this any number of times, but it only takes that one time to do it wrong for you to get back pain.
Yeah.
So, it's very important that you see your doctor, a physical therapist, and they help you, first of all, identify if you're appropriate for outpatient clinic.
Which is the first step, right? Should you be here or should you not?
Absolutely. And secondly, to be able to develop a plan of care that consists of, like Dr. Baker said, manual therapy, strengthening interventions, and extensive patient education as far as how to properly lift, how to properly bend down, stoop down, and do those things that we do on our everyday life.
Yeah, and oftentimes that patient education piece can be the most important. And maybe we only need to see you for one visit, a couple visits. We get asked this question all the time. Well, what can you help my back pain? Can you help my neck pain? Can you help this pain? Or can you help me with this type of dysfunction? Well, and honestly, the answer is always yes, but that yes might be, yes, we can help you get to maybe appropriate medical care.
Right.
If it's something that we think is a red flag that we need to screen out, we can help you move better through manual therapy, strength and conditioning, finding movements that you work best for you.
Absolutely.
And we're really good at doing that. So
absolutely. So the moral of the story is go see your doctor of physical therapy if you have back pain, and he or she will be able to tell you if you're in the right place.
Absolutely. And we thank you again for tuning in, watching episode 3 now of Balanced PT Office Hours.